Welcome to this video on understanding hospital bills, why healthcare costs become so complex. We will explore the complexities of emergency care, insurance, hospital systems, and consumer navigation with Connor Kelly, MHA. There is often an illusion of the single bill in healthcare. A single hospitalization can trigger a decentralized web of independent billing entities, including the hospital facility, primary surgeon, anesthesiologist, radiologist, and pathologist. This fragmentation means a single medical event generates multiple separate bills. Hospital billing complexity is the result of decades of compounding administrative layers. From the charitable era of the 1900s to the rise of insurance in the 1930s and 40s, and the introduction of Medicare, Medicaid, and DRGs, the administrative labyrinth continues to grow. The anatomy of hospital charges includes facility charges, professional fees for clinician expertise, diagnostic and ancillary testing, and medications and supplies. Every physical item, minute of space, and professional consultation is categorized, coded, and billed. Emergency care acts as a safety net. Hospitals must stabilize conditions regardless of the patient's ability to pay. This leads to a substantial safety net burden, often offset by commercial cost shifting, where higher rates for commercial insurers cover uncompensated care losses. Elective care is the financial engine of most hospitals. The same medical service can vary significantly in price based on the site of service. Routine services and hospital outpatient departments trigger higher facility fees compared to ambulatory surgical centers or independent physician offices. Chronic care involves a fragmented longitudinal web across multiple independent entities: primary care, specialists, labs, imaging, pharmacies, and home health. The complexity is rooted in separate medical and pharmacy benefits, duplicate testing, and a lack of centralized coordination. Hospital prices vary significantly from the chargemaster price, a highly inflated list price, to the insurer contracted rate, a heavily discounted rate, and the final patient responsibility. The sticker price is merely a starting point for negotiation, not a true market price. Hospital ownership profoundly shapes hospital finance. Community/county hospitals rely on public funding, nonprofit hospitals on commercial insurance and tax exemptions, and for-profit hospitals focus on shareholder return and margin optimization. Ownership dictates revenue aggression and service line selection. The revenue cycle pipeline is an administrative labyrinth, starting from the patient encounter, moving through medical coding, compliance, claim submission, and denial management before generating the final bill. Navigating this cycle requires extensive staff and is a major source of cost. A hidden financial trap is the difference between observation and inpatient status. Observation is an outpatient billing classification, even if a patient stays overnight. This administrative threshold drastically impacts Medicare coverage and out-of-pocket costs, particularly for post-acute care. Policy interventions like the No Surprises Act ban out-of-network balance billing for emergencies, protecting patients from catastrophic bills. Hospital price transparency rules mandate publishing standard charges and negotiated rates, though technical compliance remains variable. Consumers can defend their household budget by separating the explanation of benefits from the final bill and demanding an itemized bill. Clarifying admission status and utilizing available financial assistance policies are also critical steps for reducing financial exposure. In synthesis, how care is delivered dictates the financial blueprint. Emergency care has high billing fragmentation and uncompensated care risk, while elective care is highly profitable. Chronic care is complex due to cross-system fragmentation. For further reading, we've included key sources from organizations like CMS, the Kaiser Family Foundation, and the Consumer Financial Protection Bureau. Thank you for viewing this video.